Yo, 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 row, row, row your boat gently down the stream. Yo, yo, yo. Hey, hey, how we doing? How we doing? How we doing? How are we doing? How are we doing? What's up? What's up? What's up? Hey, how y'all doing? How y'all doing? How y'all doing? I see some people. Oh, there's only one person in here. Oh, another zero. Oh, dang, now it's seven. Hey, what's up? What's up? Hey, how y'all doing? How y'all doing? Hey, I'm gonna let people start to come up in here, but hey, if you've never been here before, of course, check out the top. I'm a Nurse NCLEX coach. My name is Kevin. We're talking about the new generation NCLEX and motivation and pretty much anything else y'all want to talk about. If you guys like the shirt, you guys can go check it out at thebootnurse.com. Go up to the store. That'll take you right there. All right. You guys can get them in different colors and all that good jazz. But hey, we're talking about the new generation NCLEX right now. You know what? It's been 10 days since the NCLEX has come out. So who's taking it? Who's taking it? What do y'all want to tell us about it? Like, give us the skinny. I already know pretty much everything that's going on because your boy made a big old long cheat sheet. So I'm actually going to be making that cheat sheet available to everybody that goes to my website. That'll be up here in the next week. You know, it's like my little freebie to give to y'all. So we're going to put that up there, but we'll go over some things that I put on the little cheat sheet. It's really important things to know in regards to the NCLEX and all the things that have changed. But if you just jumped up in here, my name's Kevin. I am a nurse. I'm an NCLEX coach, content creator. We're talking about the new generation NCLEX. If you guys know anybody that needs coaching in regards to nursing, NCLEX, preparing for the license, I don't care if it's your first time, second time, third time. If you're a nursing student about to take it, check out thebootnurse.com. I got a free 30-minute consultation over there, as well as I have coaching as well that to follow on after that. But then, of course, here I am as well, talking to you guys, trying to give you guys all the lowdown and all the good stuff that's happening within nursing, especially with the NCLEX. So what I want from you is to tell me who you are, where you're from, where you are at in your nursing journey. Have you taken a new generation NCLEX? What type of nurse that you want to be? Are you a veteran nurse? Are you a nurse who's been in the field for a while? Are you a brand new nurse who just passed your NCLEX and you want to know what direction to go? Holla at your boy. But one of the most highly recommended things here I need for y'all to do is to smash that like button. I want to see the right side of this damn phone flooded with hearts. You want to know why? Because y'all love me. I'm just saying. Anyways, hey, that's what we're going to be doing today. I'm going to pull up that cheat sheet here in a second. We'll see what we got, and we're going to talk about some things that have happened and some things that have changed and things to be pretty much aware of. Okay, so let's see what we got going on down here. So I'll probably stream till about 10 o'clock. I actually wanted to stream earlier, but then I have family call, and then if it's your first time here, I have a son. Actually, I have two of them, and they're both turds. So they require a lot of attention. Well, one of them does. The other one kind of just moseys on and does his own thing. So, Oh, and also we could talk about, failures. So we can talk about, hey, who hasn't passed the NCLEX? Raise your hand right here. Both hands. It's The Rock. All right. So anyways, I failed the NCLEX multiple times as well. And don't let that deter you. Don't let that deter you if you were unsuccessful at the NCLEX. The one thing I want you to do is that if you were unsuccessful, you get 24 hours to feel bad about yourself and to feel bad about it. On hour 25, you better be figuring out what you didn't do well and how to audit yourself and then keep it moving, keep pressing forward in a positive direction. Who is it? Is it Brim Morin? How often do you do these? At a minimum right now, I do them Mondays around 7. I started later today because, like I said, I had family, and then Fridays around 7. So I usually, I have a job. I work as an operating room nurse. I've worked in many other different areas as a nurse within my 3 years of being a nurse. I worked in the ICU. I've worked in the PACU. I've done some pre-admission stuff, and I work in the operating room. So, and I currently work as an operating room nurse right now. But I do these Mondays and Fridays. I'd like to try to put a poll out every so often to let people know, and especially to put the notification button on for TikTok, as well as go over there and follow me on all those other social medias. That way you guys know when I'm putting stuff up there. I share a lot of stuff on Instagram, especially like a lot about remote jobs, memes. What else? Just other little important things. And then, of course, whatever I feel like makes me laugh and what I think will make y'all laugh. So there's that. But make sure you guys follow me, especially on Instagram, because with the state of like how everything is going with TikTok, which I really don't think anything's going to happen to it. And if it does, something's going to happen to it. And then it's going to be under, our control. And then we could do, we'll be able to have them back again. But at a bare minimum, I want everybody to be following me on Instagram. So we can talk about, whatever. And I did one live on Instagram. And I had a good amount of people kind of turn out, maybe like 20. And that's really good on Instagram versus how, TikTok follows the algorithm and it throws people out there. So, and the more you guys smash that like button, the more the algorithm will start to push it to people who need something like this. I can't even tell you how many people were just like, I'm so glad I found your channel, or I'm so glad I found your TikTok page. So an important thing, number one is, of course, the NCLEX officially changed to the new generation NCLEX on April 1st. It wasn't a joke. It's not a game. The NCLEX has changed. So what I want to know is how many people have taken the new generation NCLEX, and how many people like it. Like, what's their experience? Like, let us know down in the comments. And also, if you guys got any good tips about anything, make sure you guys drop them down in the comments as well, because, hey, sharing's caring. The next thing is the new generation NCLEX still uses computer adaptive testing, which means that the answers for each question determines the difficulty of the next question you get. So if you've never taken a computer adaptive test, number one, if you are a nursing student or a nurse or anything like that, the rest of your exams within the nursing field are going to be computer adaptive. Every single one. It doesn't matter if you're going to go get a certification like for, we'll say, a certified ER nurse or critical care or certified critical care registered nurse. Any of the tests that you guys are going to take in the future, they are all going to be computer adaptive. So, and computer adaptive, it determines, the next question is solely determined by you. So if you get a very basic question like, hey, what is a normal blood pressure? That's an easy leveled question. If you get it right, then it's going to give you a harder question. If you get it wrong, it's going to give you an easier question. I don't know what easier question is. What is a normal blood pressure? If you're getting questions that are if you're getting questions that are based off memorization, the light bulb better need to go off in your head that, hey, maybe I'm not doing so well on this exam. Okay. And so a correct answer makes the following question harder, while an incorrect answer makes it easier. The goal is to achieve and maintain a certain difficulty level so the test algorithm or the computer algorithm can evaluate your knowledge levels. So if you're getting easy questions, but you can't get the hard questions, the test is just going to keep you at the easy level questions. So that's why when you see people that fail at 75 questions, that means that they were doing terrible. And the first time I took my exam, I did terrible. All right. So, what is still in the NCLEX? So all the old question types are still on the new generation NCLEX. The types of questions that you may see on the new generation NCLEX and the old one, but the old one's gone. But you're still going to have multiple choice. Those are not going away. They're the most common form of questions on the NCLEX. So that includes your multiple choice, and where you provide answers to the question to which you must select the correct one. That's pretty self-explanatory. Select all that apply. The good old SATA questions, or Satan questions, as people like to call them. Those will still be on the exam. Hotspots. So the area where they give you a picture and they ask you specifically like, hey, where is this? Or the really good classic one is that you need to draw a blood glucose from a patient. So where exactly on the finger do you poke at? Right? You tap on that spot. The test gives you a very, small window of where you can be, and then you'll get the answer right or you'll get it wrong. Fill in the blank. So fill in the blank questions require that you enter a free text answer, such as dosage calculations. Those are also still going to be on your exam. Quick side note about that is on my NCLEX, on the last NCLEX that I took, when I passed it, I didn't get any dosage calculations, none whatsoever. But the test before that, I got 2. The test before that, I got 1. And then the very first test, I got 2. So not saying that they're going to drop so many dosage calculations, but I know a lot of you math whizzes wish that you guys had a bunch of dosage calculations, since they stress that hardcore in nursing school. Like, you can't get the math wrong. You have to get 100. I've heard of so many of those saying, like, you have to get 100. And it's like, that's wild. Then you got the drag and drop. And this question format is normally used to have the test taker order the answers in the correct order. So putting them in correct order. Like, how do you put on your gown and gloves? Or what is the sterile technique of doing a Foley catheter? Something along the lines of that. Like, how do you do something like that type of task? As well as what's another one? What's another really good one? Dressing changes. That's a very common one you'll see on NCLEX as well. As well as how to hook up a pneumovac for a patient that's getting a chest tube. So graphs and charts. These questions consist of images and text. An example of these would be name of a heart rhythm based on its appearance. So if I gave you a heart rhythm and it looked like it was a squiggly line, like all over the place, ultimately in your mind, you'd be like, that sounds like ventricular fibrillation, right? So I see so many people joining. I appreciate you guys joining and jumping in and then, jumping out and then jumping back in. So I appreciate y'all being here. If it's your first time coming here, my name is Kevin. I go by the Boot Nurse. I was established in 2020. I'm a nurse and NCLEX coach, and we're talking about the new generation NCLEX. So, we're going to talk about that. If you need coaching or anything along the sort, or anybody that does, check out thebootnurse.com. Got a 30-minute consultation. You better get it while it's free. You better get it while that consultation is free, because I'm telling you right now, it's going away. What did that say? Heist the God of Promise, or is it Heist the God of Promise? I hope I said that right. And you're new here? Well, I appreciate you being here. Welcome, welcome, welcome. Let everybody know where you're from. Let us know like where you are in your nursing journey, what questions you have. And if I can't answer them, I hope that somebody in this group or in this live stream will answer that question for you. Because, hey, we're all about pushing that positivity through nursing. So did I say it wrong? Oh, he is the God of promise. Okay, I got you. Hey, look, when things are pushed together, I'm just like, is it Hesse's heist? Because if you look at it, it looks like heist. So I'm just saying, heist he God, or you know what I'm saying. So, but welcome. I appreciate you being here. So, so we were talking about the graphs and charts. Those are the type of questions that are still going to be on the NCLEX. They were on the old one, and now they're on this new one. The next one is graphic answer multiple choices. This is the same as a normal multiple choice question, but uses graphics and images instead of text. That's pretty self-explanatory. And then, of course, you have your audio and your visual. So that's essentially, they'll play a video. They'll ask you like, hey, what does this look like? Or they'll play an audio. They'll be like, hey, what does this sound like? Ones that they really love to throw on NCLEX about, hey, what does this sound like, are like the lung sounds. Like, is it wheezing? Is it crackling? Is it ronky or anything like that? Those are big ones. So those are the existing questions that are still on the NCLEX. Let's talk about hard question content. Before I get into hard question content, if anybody ever needs to know what's going on with the NCLEX, is you want to go to the National Council of State Boards of Nursing.org. Or for short, it is the ncsbn.org website. Okay. N as in November, C as in Charlie, S as in Sierra, B as in Bravo, N as in November.org, O-R-G. They are the ones that write the test. They are the ones that write the NCLEX for you, me, and every other nurse that's taken it here in the United States and in Canada. So, hard questions. One of the NCSBN's findings when evaluating the NCLEX is that nurses are more often caring for critically ill clients that have traditionally been the case. So that's why the NCLEX is actually changing, is because more and more and more things are starting to happen to nurses out in the field, and nurses are starting to or have been thinking critically for years. So the exam wants to essentially kind of backtrack to where it's just like, all right, we need to start your critical thinking in nursing school, but we need to get it up to the level, or at least the basic level that you need to know before you get out to the field and start taking care of patients. So that's why the harder questions are being put in there. This increases client acuity, means that the new NCLEX is going to have more difficult with more difficult questions with an increased focus on caring for more critically ill patients. So it gets the gears turning very, very well. Hindsight is 2020. Like I said, I've worked in an ICU for a year. I worked in an OR. I worked in PACU. So hindsight's 2020. You asked me this question 3-4 years ago, I'm gonna be like, duh, like looking like a deer in a headlight. But now, as somebody who has taken the practice exams for New Generation NCLEX for the last couple of months, as well as somebody who's worked in critical care, is I like to change. I like to change. And one thing as a nurse is that you have to be able to adapt to change. You have to be able to, it's either adapt or overcome or get left behind. And that's why you see a lot of people leave, or you see a lot of people who are just like, I don't want to do this new test, so I'm just not going to learn it. Well, I guess you don't want to be a nurse. And that's the thing about medicine, is that medicine consistently changes all the time. And you have to be able to adapt. That's how these new technologies and these new techniques, help save lives. Like, well, I'll give you an example. Like the Da Vinci robot, it's created by a company called Intuitive. They have research that shows that using the robot actually decreases the amount of the longevity of a hospital stay for a patient, because the robot it has so much stability. It requires less hands to deal with the patient, and it has a lot of precision and stability. And it's great. I work in the robots and I love it. I love working in the robots. So I would definitely say, if you guys are into doing if you want to be an operating room nurse, robots are pretty cool. If you want to get messy and see a lot of like joints and stuff, ortho is where you want to be, or you can get real into the nitty gritty and go into neuro and be with neurosurgeons, or be, in the hearts and work in vascular and, do bypass and stuff. Hey, the world is your oyster, whatever floats your boat, your cup of tea, whatever you want. The case studies were a good thing. I like them. And I'm glad. Who is that? Is that Coco? I'm glad that you like them, because essentially that's how it's going to be. Like that is where nursing is going in a forward direction. I don't think you guys really realize that the level of responsibility that nurses are getting. Look at what's happening with nurse practitioners. Like, now they're independent practitioners where they don't necessarily have to work under a provider. They can open up their own practices and practice independently. Like that they couldn't do that 20 years ago. So you got these nurses that are out there in Washington, D.C. lobbying for us as nurses to get those greater things and a lot of those responsibilities, because to be completely honest, it's like the doctors, they do the medicine aspect, but nursing, we take care of people. It's patient first. I'm not all about trying to give you meds, even if I don't need to. I mean, I'll give you meds as they're prescribed, but it's patient first. Hannah, hi, how are you? Hannah is a long time follower of me and jumps into every live that I do. So Hannah, I appreciate you being here. Hey Hannah, make sure everybody on here, make sure you guys share this live. All right, and make sure you guys like. I smash that like button, okay? And so, back to the nurses is like my son's provider is a nurse practitioner, and she's a phenomenal nurse practitioner. Like she's very, very intelligent woman. She knows any and everything that's going on with my son, and I love everything about it. So yeah, that's why they're changing. Now, let's talk about the new question types that are on the NCLEX for those that haven't taken it, right? Because it's still very new. And not only is it very new, there's so many people that haven't taken it. So many people that are afraid to take it. So while the existing NCLEX questions are retained, there are multiple new question types on the new generation NCLEX that are significantly different from what nursing school has been accustomed to. So you got to think, not only is this change happening, it is changing at all levels. So you got to think, what is this going to do in nursing school for people? Like how are we going to start accommodating, or adapting to the new generation NCLEX, right? And you have to start in nursing school. One thing I didn't love about nursing school is that our exit exams were NCLEX style. This is when I was in school. They were NCLEX style, the exit exams, but the tests that were in school were not. So I said to myself, why not teach to NCLEX? Because that's exactly what the test is. So why not teach the NCLEX? Give us NCLEX style questions. By the time we get to NCLEX, we should be, we should be shattering that goal, and there you shouldn't have any failures. I mean, you will, but you shouldn't, right? So, let's see, where was I? Significant changes for nursing. Yep. So, scenarios. So here's something that is super important about the scenarios. Scenarios or our case studies or however you want to call them, right? NCLEX questions have traditionally been standalone questions, each question unrelated to others. In the new generation NCLEX, 2 to 8 questions may be derived from a single case study. So I'll just paint a picture for you. I'm going to give you a case study over here on the left side of your screen. That case study will give you everything that you would remotely need, right? These cases provide like the record, the client record with multiple tabs and split screens, right? So it could give you the patient's labs. It could give you the patient's signs and symptoms, give you their vital signs. And then, of course, you got everything subjective everything subjective that the patient is telling you. Right? Oh, I've been having shortness of breath for 2 days. And then objective, like, what do you see? What do you see is just like you observe as the nurse that the patient has peripheral edema. You see that they're kind of hunched over. You listen to their lung sounds and you hear crackling. They're coughing and it's a wet cough and they have pink frothy sputum. And I'm just like, okay. So there's those telltales that are telling me, okay, this person looks like he's having maybe a congestive heart failure thing. He has peripheral edema going on. And he has crackling. Oh, he has fluid on the lungs. So maybe the first thing I would want to do is, if I've already gotten vital signs, maybe we need to talk about, hey, let's getting some diuretics in him to flush to get all that fluid off of his body, get that swelling down off of his legs, as well as get that fluid out of his lungs, right? So that is what the case studies or the case scenarios or whatever you want to call them, that is what they are trying to do. They are trying to give you all the information right there in front of you. There's no guessing. The biggest thing about NCLEX is that they're always like, oh, but what if they're asking about this? Nope. Not what they're on multiple choice questions back in the day. That's what they did. Now they don't do that. Now it's just like, hey, I'm giving you everything. So I'm taking the guessing out of the questions. I'm taking the guessing out, right? So the client's record is on one side, like I said, and the question will appear on the other, with multiple or non-adaptive questions. So if I give you the case study on the left side of your screen, the question will come on the right side. So if they give you a whole case study on your left-hand side, they could drop a multiple choice question over there. And once they drop the multiple choice question, then they could do a follow-on question to that multiple choice question. Or they can give you, based off of the vitals, you notice that, and then they have fill in the blank. And with the fill in the blank, they have the aspects of where you have like 3 answers and essentially kind of like completing a sentence, right? So that is what the case studies are. And that is what people are afraid of. Do not be afraid of them. Just like everything, you have to practice and adapt. Practice and adapt. But also know is that if you don't understand content, it's going to be very hard for you to grasp the type of questions that they are asking. So if you don't practice, and if you don't practice like you're going to go out there and play and show out at the Super Bowl, then how do you expect to pass? All right. So remember, this is all about investing in a good NCLEX review and all that good jazz, right? And that's something that we'll talk about later. Hey, if you guys are just joining me, my name is Kevin. I am a nurse and NCLEX coach. We are going over all the biggest changes that happen within the NCLEX. And the NCLEX is the nursing license for RNs and LPNs. If you are in need of passing, or if you've taken your NCLEX multiple times, or if you're a nursing student that is about to graduate nursing school and wants coaching, check out thebootnurse.com. I do a 30-minute consultation over there for brand new nurses or for anybody that is trying to prepare for the NCLEX. You better get it while it's free because it's going to go away. But it's going away mostly because I have some stuff that I'm going to be providing and giving, and not it's giving to you guys, but also offering you guys as well. So you guys better get that free coaching while it's free. The coaching itself is not going away. It is just the free aspect of that. If you guys want a shirt, check out thebootnurse.com. And then go to the tab store at the top, and it'll take you to my little store, and you guys can get you guys some merch over there. Your boy would greatly appreciate it. But yeah, so case studies, that's where we left off. Let me see, some people are dropping questions in here, so let's see what's going on. Do you believe it's more studying content or question? Do you believe it's more studying content or question style is the hardest part? I say it's about half and half. Was it Kiki? Kiki didn't love me. All right, I'm sorry. I couldn't help myself. So, but I think it's a bit. It is a bit of both. It's kind of like your content and questions. It's like your yin to your yang, or your meat and your potatoes. Husband and wife, whatever. They both play a very important role because you have to be able to get a good balance of understanding content. Let's just say you already understand content very well. Then maybe you don't need to spend so much time studying content. You need to spend more time on your questions, but only you know that. Only you know that. I can tell you right now that when you take your NCLEX, they're not going to be going over, hey, let's talk about arterial blood gases. Hey, let's talk about chest tubes. Hey, let's talk about pharmacology. That's not what your test is going to be on. Your test is going to be on questions, right? So while I would say spend a good amount of time on studying content and taking down your notes, so on and so forth, more time needs to be studied on the questions, NCLEX style questions. I hope that answers your question. If you guys got any more questions, make sure you guys drop them down in the comments. If not, we are going to press on. So here's another one. Extended multiple choice questions, right? A significant difference with these questions is that partial credit is given for answers that are close to correct. So you're welcome, Kiki. So extended multiple choice. Now you can actually get partial credit on extended multiple choice questions, right? There also is the extended multiple choice questions are considered the select all that apply. Those are also now partial credit. But we're going to get into the scoring of how those are done here shortly, but we're going to finish going up through the questions, okay? Drop down answers, essentially a cross between multiple choice and fill in the blank. These questions provide a drop down list of possible answers to complete a sentence. Just like I said earlier, right? They're going to give you essentially a long sentence or maybe a few sentences, and they're going to be fill in the blank. Once you hit that drop down, you're going to get anywhere from 3 to 4, maybe 2, 3, 4 answers to choose from to complete the sentence. But you have to make sure that you get them right. I do believe that those are also partial credit. I'm not sure, but it doesn't state it like anywhere in doctrine that I've seen. If anybody has seen it, please let me know. That way, we can get that right information out there. You have extended drag and drop. This question type is like traditional drag and drop, except that there are more answers than spaces, and some answers do not need to be included. So, let's just say you have 5 answers, but they'll give you 9 choices, or 9. They'll give you 9, or you have, we'll say 5 slots, and they give you 9 answers. Only 5, you're only going to need 5. Whole point is to distract you, right? So that way you need to know like what goes where. And I like to say that a lot of times about delegation as well. So let's see what's going on. Nope. So, sorry, I just got a message from something else. But let's see. What else? Extended drag and drop. Okay, so highlight text. That's what we were talking about. Highlight text. These questions are answered by highlighting an area of text from a given passage. So when you guys are doing the NCLEX and you're doing a case study, or they're giving you a case study as a question, over to the right, it'll be like highlight the important, or highlight the vital signs, or highlight all the important things that you need to know about the patient. And it's just as simple as going over to anything that you've ever highlighted and highlighting it. And then once you're finished, you hit next. And if you were correct, it'll let you know it won't let you know during the test if you're correct, but just know that when it comes to highlighting things, read the question of what they want you to highlight and think of the important things that you know would need to be highlighted, such as vital signs, it's like sample history, lab values, your observations, what they're telling you. Like I have shortness of breath, or what you observe, like lung crackles, as well as peripheral edema, stuff like that. Okay, so highlighted text. In my opinion, if they gave me a case study for every single one, and you can get up to 8 questions out of one case study, I mean, if you think about it, do that math. I mean, it wouldn't be probably anywhere near 70 questions or 70 or 75 or 85 traditional questions, right? So then you have the matrix grid. It says seen on multiple response answers. These are like select all that apply questions, but are more just like select or don't select options. For example, there may be a list of 8 different interventions you have to choose if they are accepted, non-essential, or contraindicated based on the question stem. So they're going to ask you a question, they're going to give you the answers, and then you going to click which ones apply. Select all that apply. Who would have thought, right? So, and then of course the last one is that you have trends. These question types test the knowledge, they test the knowledge of NCJMM, which is a series of steps for measuring clinical judgment. That's what the trends are. So, and a good way to measure trends is when you look at patients' vital signs, when you look at the patient's labs, because remember, lab values you have to memorize, right? Vital signs you have to know. It's just like, man, like, okay, if they have a high heart rate and a low blood pressure, man, could they be bleeding somewhere? You know, like it's just those are the things that they want for you to see. Okay. And those are the new types of questions that are on the NCLEX. If you guys are getting value, make sure you guys smashing that like button. As well as if you guys have any questions, comments, concerns about anything, you guys ask me down here in the comment section. But if you are just now joining, my name is Kevin. We just got finished talking about the new types of questions that are on the new generation NCLEX. And that's all we're going to be talking about. Talk about whatever else as well. In the nursing field, if you or anybody else needs coaching or anything in regards to nursing, check me out at thebootnurse.com, especially the coaching for the NCLEX, because I have a 30-minute consultation that I do over there for free. And it's 30 minutes. I also have you fill out a survey as well with that. So that way I can pretty much know all the important things that I need to know. That way I can solely focus on, hey, these are some things that I would recommend based off of what you told me. And if you have, we'll see what we could do, for you after that. Make sure you guys check out the merch Boot Nurse established. Everybody is the term baby nurse I don't like. And I think I like boot because I'm in the military. I've been in the military for over 15 years. And, that's a term that we call a newbie that comes into the military. We call them a boot. So instead of a baby nurse, I call me a boot nurse. Like I walk around, I'm a boot. I don't know nothing about nothing. So I need for you to guide me. And the thing about being a boot nurse, it is a way of life. The whole point of it is a consistent learning, because you're always going to be new at something. You're never going to know everything. Things are consistently changing, and we're always learning. So I'm a boot. You're a boot. Welcome to the Boot Nurse NCLEX review channel, TED Talk, whatever you want to call it. So welcome. I take the NCLEX May 5th. Brandon, hey, congratulations. Don't be scared of it. Just prepare for it, and you can go out there and do well. Like you got, a little less than a month, Brandon. So get out there and get your study on. All right. Let everybody know, like, did you just graduate school? Like, are you about to graduate? Like, let us know. And as a matter of fact, everybody who's in here, the 14 people that are in here, y'all let me know where y'all are from. Let me know where you are in your nursing journey. Like, let's get a conversation going. So something else that's important that we're going to be talking about here is the number of questions that are on the NCLEX. Now, I was looking at something very different when it came to the questions, and I saw it on multiple different pieces of like doctrine or, whatever you want to call it. And I thought it was 75 questions. However, it is not 75 questions. It is 85 questions. So the new generation NCLEX has 70 to 135 questions. 15 of those questions are considered pre-test questions or like research questions, so to speak, right? Which was previously 160 to 130. Oh, I'm sorry, 60 to 130 on the old NCLEX. The unscored questions won't contribute to the overall score, but is used for future exam development, right? So your NCLEX is 185 to 150. 185 to 150, with 15 of those being research questions. The research questions do not count against you. There's nothing different about how the NCLEX did that, but they're just giving you more questions. And the reason why they're giving you more questions is because you can get anywhere between 2 to 8 questions out of one case study. Okay. Among the scores on a minimum length test takers should expect to see at least 3 case studies with 18 questions, which make up 21% of the overall score. So there's that. Let me check out some of these questions, which y'all are talking about. I already failed. I'm a repeat. I graduated in January. Okay, cool. You failed, Brandon. That's all right. But guess what? You just told me that you're retaking it. So what I hope happened is you audited yourself. You see what you did wrong. And you looked at your breakdown, see where you need to adjust. And now you push forward. So hopefully some things changed. Some life things changed. Some study habits changed. And now when you go through and you take your NCLEX in less than a month, you're going to go out there and you're going to conquer, come back and tell us how you did it. And, spread the love. Everybody's going to give you your flowers, and then you're going to keep it pushing and come out here to this nursing world. So that's what I'm hoping. Whoa! I fell, but I'm here. But yeah, that's what I'm hoping. So I wish you nothing but the best of luck, brother, when you take your exam. Okay. I'm still trying to figure it out. Who is that? Sharia, what are you trying to figure out? I'm confused. White Plains, New York. Is that in Canada? I feel like that's in Canada. I'm sorry. White Plains, New York. I think that's in Canada. I took the new the next gen NCLEX last week and passed from NY. That's what I'm talking about. Who is that? Coco? That's what I'm talking about. Hey, congratulations to you. Congratulations to you on passing the NCLEX. And welcome to the shit show. Hey, so funny story. I was laying down and I was looking over. It was like right after I got finished doing a live. And I laid down afterwards and I fell asleep. And my girlfriend told me when I was sleeping that I was singing like a jingle in my sleep. And I don't talk in my sleep. But she said I sang like a jingle. And then all she heard me say was, "Welcome to the shit show." And then I started snoring. And I'm just like, what? And this is really funny because anytime I tell any nurse, any brand new nurse that's now become a nurse and that has gotten their license, is like, "Welcome to the shit show," right? That's just a common thing that we talk about as nurses because nursing is wild out here. Nursing is wild out here, let me tell you. Hey, but the bags are nice depending on where you go and depending on what you do and depending on where you specialize. So the bags are nice. They're real nice out here. So congratulations, you, Coco, for passing. Everybody give Coco flowers. Give her a shout out. Go give her a follow. You ready for the circuit? Oh, I don't know. What, where you, Coco, what do you want to do? Well, first off, was it RN or LPN? And secondly, where do you want to go? What type of nurse do you want to be? I take the NCLEX on April 22nd. That's right around the corner. That's in 12 days. What does it say? Peace. Well, like I tell everybody else, I know that you, prepared and are continuing to prepare. One thing I'll tell you before you guys take your NCLEX is make sure the day before you take your NCLEX is to relax. I know that's better said than done, but don't do anything in regards to studying for the NCLEX at all. Because if you try, like, cramming doesn't work. And if you've been studying like you should have been studying for how long, if you don't know it by then, you don't know it at all. Remember, the NCLEX is not about memorization, although there are things that you mandatorily have to memorize. You need to know where the cranial nerves are. You need to know what lab values are. Those are mandatory things that all nurses need to know, right? So, but it's all about being familiar. I would never expect for you to tell me line by line every beta blocker. But I do expect for you to know that every LOL is a beta blocker and every beta blocker is an LOL. And 9 times out of the 10, based off of when I need to know when you give it, when not to give it, and what are the signs and symptoms of me giving it. Because the NCLEX is all about nurse safety, right? Can you be a safe nurse? Remember, this exam is scored from a 0 to 100. All you need is a 50. That's essentially what it's saying. You need to get above half. What exam you've ever taken says, "Hey, get a 50% and you Gucci"? No, okay. All right, stop playing with me. All right. Yeah, you got 12 days. And you're gonna do it big. Coco, you want to be? Oh, you're an RN, okay. And I want to try for NICU. So here's the thing. You guys ever heard that term by Yoda? Of Star Wars, I'm a big nerd. I don't know if y'all know that, but I'm a huge nerd. I love anime. I love Star Wars. I love it all, right? Not all of it, but a good amount of it. And just like Yoda says, he was just like, do or do not. There is no try. So if you want to be a NICU nurse, go and be a NICU nurse. I'm all about speaking things into existence. I feel that whatever I put out into the universe is going to get back to me. So if I said to myself that I was going to be an ICU nurse, call them hell or high water. The first job I ever got out of nursing school, was in a burn ICU, and I worked there for 6 months. Then I went to a medical ICU, and I worked there, a medical and a neuro ICU, and I worked there for another 7 months. And then I got out of the ICU. If you guys want to know why I got out of the ICU, just go to my page, and you will see 4 videos on why I left the ICU. Don't get it twisted, because your boy is actually going to be making some more videos about some things, some icks, right? So some icks from people and some icks of just the way the system just works. And it's kind of wild out here. So, NICU, hey, get out here and take care of our babies. Take care of them. Miss Missy 218. How do you feel about the NGN? I like it. I'm gonna be all the way real. No cap. As the youngins like to say. What the fuck? But, I like the new generation NCLEX. Hindsight is 2020, because as an ICU nurse, when I was an ICU nurse, I wish that I could have at least had the thought process to critically think, versus how in school, they just push you, like you push. So a lot of times you feel like you don't remember. It's a lot of data dumping. Plus, a lot of things have happened over the last, 3 years, where a lot of the nurses that are coming through school, they didn't even get clinicals. They got shafted on a lot of stuff or a lot of things. And they didn't get it. So I think this is a way to try to combat that and make it a new norm to critically think, because you have to learn how to critically think almost everywhere in nursing. If you're working on the floor, like the med surg floor, you gotta know what is happening with your patient. You have to. Hell, even in pre-op, like in the preoperative area before they go into the operating room, if you have a patient who showed up and we tell them, if you have a patient that shows up and all of a sudden they have all these crackles, and then you listen to their lung sounds and they sound terrible, then you draw labs on them and their potassium's like through the roof, critically, you got to be like, oh, whoa, okay, that's not good. Your potassium's too high. Your creatinine's too high. All these other things, like your Pt.3 is low or whatever, right? You got to be able to know these things in order to know, hey, let me call the doctor. Let me see what's going on. Hey, what if their glucose is too high? If their glucose is too high, we can't do surgery on them. Their blood pressure is too high. We really can't do surgery to them, because the medications that they're going to get from anesthesia are going to really mess with, you become hemodynamically unstable, especially with the trauma of me cutting into your body. There's so many things. So critically, you have to know the basics of critical thinking. Your critical thinking will expand once you start working in the field. So I know that was kind of a tangent and kind of a rant, but Miss Missy 218, I like the new generation NCLEX. I do. I failed the NCLEX on 325 with near passes and got all 145. I'll be back for the new. You damn right you got this. Playing games with me. You got this. You got this. Trust and believe me. You got this. I'm doing Archer questions and mixed NGN. I got high chance passing now. I'm remediating. I have faith. That's right. Put it out. Miss Missy, I want you to put it out into the universe. And I want you to say all the time, I will pass NCLEX. And hell, even answer yourself. I had sticky notes that said, I will pass NCLEX everywhere. Behind my computer, on the door, in the garage, on the steering wheel in my truck, in the bathroom. Inside the refrigerator. Who does that? Me. Because no one's going to believe in me more than me. Nobody's going to believe in you more than you. Right? So put it out there. Continuously say you will pass it. You will pass it. Use your breakdowns as motivation, as in that's not happening again. That's not happening again. You have to put all that positivity out there. Okay? And you're very welcome. I'm all about spreading that positivity, because look, y'all want to play games with me? I know some of y'all have seen me talk about it, but look at this. These right here, these are my breakdowns. 1, 2, 3. What better person to tell y'all, hey, it's okay if you fail, but it's not okay if you stay your ass there. 1, 2, and 3. And then the license is over here somewhere. No job is ever going to ask you, hey, how many times you failed at NCLEX? Nah, we don't want you here. We don't want you here. I do have here's a funny story. I told people outright that I failed my NCLEX 4 times, and it was in a nursing group. Flat out told them. And I told them I failed and I did this and I did that, but I overcame. And then some nurse, I kid you not, a 20-year veteran of a nurse, flat out said that I would never want you to take care of me and my family if you don't know how to take a test. And my petty remark was, that's cool. I guess I won't take care of you or your family. It ain't no skin on my back. Because what patient will ever ask you, hey, how many times have you taken your NCLEX? Hey, how many times? They don't give a damn about that. They look at you and they're just like, oh, wow. Like, you're a nurse. You do this, you do that. It ain't no skin on my back. So, like this nursing is my second career. My first career is military. Like I said, 15 years. And I hit 16 years in September. So I'm on the cusp of retirement, right? And when I hear somebody talk to me like that, I'm just like, oh, okay. I mean, you want me to leave? I'll leave. I've had patients fire me before. They were just like, I don't want you in my room. I'm just like, but there's no one else to take care of you. Well, I don't care. Get somebody else. Well, there's no one else to take care of you. Well, you're fired. I don't want you in here. Oh, okay. All right. Have a nice day. And I come back in there 20 minutes later. Can you help me with something? But you fired me, though. Well, you're unfired. Oh, okay, cool. You see, like, I don't be letting people do this to me. I don't let people bother me. You got to think, it's like when people are in the hospital, most people are at their worst, right? There are 2 things that I really want people to take away from this is like what's the one thing that you care about when you're not sick? You care about everything when you're not sick, but when you're sick, you only care about one thing, and that's not being sick. So, we have to be able to adjust and, let people know like, hey, what's going on. But based off of that 20-year nurse who was a veteran nurse, and I think also a veteran, like in the military, I think she was an Army nurse or something like that. When she told me that, it was funny because the comments went in on her. They were just like, you of all people should never, ever do that to anybody. You're just like, hey, you're supposed to help. You were supposed to help each other out, right? It'd be different if you were just a complete shitbag, but that ain't the case. So if you guys are just joined, my name is Kevin. I'm a nurse. I'm an NCLEX coach. NCLEX is the licensing exam for nurses. If anybody in here is not a nurse, we're talking about the new generation NCLEX because the licensing exam just changed on April 1st. That's what we're talking about, along with motivation and failure and how to push forward and how to audit yourself and all that good jazz. If you or anybody else needs NCLEX coaching, check out thebootnurse.com. I don't care if you're taking the exam multiple times. I don't care if you're taking it once. I don't care if you're a nursing student about to graduate and getting ready to take it. Check out thebootnurse.com. Also there, 30-minute free consultation. Anybody that needs it, you better get it while it's there because it's going away. I know I say it all the time, but it's going away. Also, go check out that store tab and check out the merch. And go get yourself a shirt. And then when you get yourself a shirt, send it to me on Instagram. And then on Instagram, I'm going to tag you. Be like, hey, shout out to you for the support. All right? Because this is a movement. I'm telling you right now. This right here is a movement. And I will shout out to anybody. And I don't forget folks like that either. So, 2 years from now, when y'all see me doing Kaplan interviews, I'm going to be like, hey, I remember you bought a shirt. Okay. So, but let's go on. We're going to talk about the new NCLEX scoring system. Now, this is what's really, really important, right? Traditional NCLEX questions were either right or wrong, and they were all worth 1 point. So, like, if you got it right, it was worth 1 point. If you got it wrong, it was worth 0 points. They call this a dichotomous scoring system. So it's an old scoring system. So if you got a multiple choice question, you got 4 choices, you pick one, you got it wrong, 0 points. If you got it right, it was 1 point. Select all that apply. If there were 4 answers that you needed to pick out of the 6, if you picked 3 out of the 4, the whole question was wrong, right? But if you got all 4, the whole question was right. You guys picking up what I'm putting down. The new generation NCLEX style has a new scoring system that allows for partial credit. It's called the plus or minus scoring, or the dyad system, or dyad scoring, or triad scoring, as they call it. Oh my goodness. Y'all hear my son? He just did something. Hold on. What did he do? Man, he gonna have an iron head, let me tell you. Oh my God, he got an egg. Hey, get out. He does an indent. Does it? Where did he hit his head at? Oh shit. Oh. Hey, he good. And that's what happens when you're one and you're walking, bro. You think you can just walk through everything. He good though. He all right. He's my little light-skinned twin. If you guys go over on my Instagram, you guys will see him. But yeah. So all of the items will be either correct or incorrect, and some will be partial credit. This is referred to a polyautonomous scoring. That's what it's called. I'm over here just like, bro, I don't know how to say that word. That's weird. So let's talk about the plus or minus scoring. If you guys have any other questions about this, this is something that I'm going to throw onto my website so you guys can get a freebie. I'm going to start dropping links and stuff like that throughout the week. So make sure you guys are paying attention on my Instagram and all that good stuff so you guys can go find this link so you guys can get this cheat sheet for yourselves, okay? So the plus or minus scoring. Test takers earn 1 point for each correct response and lose 1 point for each incorrect response. If the score is a negative, the final score will be reduced to a 0. Points are not deleted for incorrect answers. So let's just say, for example, you'd had a select all that apply question. And it was, we'll say it's 6 answers. But you only picked, let's say it was 6 answers, but 4 of the answers are correct. If you pick all 4, you get, that's considered a partial, you get the whole point. Versus if you picked 3, let's just say you picked 3 that were correct and then the other ones that were incorrect. So you get point, and then once you get the incorrect one, it minuses a point. But you can't get negative points, if that makes sense. Like you can't get a -1. Like it's either you're gonna get 1 point or 0.5 or 0.4 or whatever, and then 0. Like you can't get anything lower than a 0. Okay. And then you have the dyad and triad scoring. In the dyad scoring system, if both answers in a paired set are correct, you get 1 point. Okay. In a triad scoring system, you get 1 point for each correct answer. If you get all 3 correct, you get 2 points. That's how it's done. Okay. And then you have your standard items such as fill in the blank, numerics, multiple choice, multiple response, select all that apply, hotspots, and order responses will continue to be 1 point. So each question, depending on the question, are worth different points. And I know which ones that they're jumping into to do that. And those are definitely the case studies, the highlighted sections, the fill in the blanks. So all of the new type of questions will get those as well. And it says multiple response items will receive partial scoring as well. And those are the big important things that people need to know about the NCLEX. So you still get 5 hours to take the exam. And this is something that I want to really, really reiterate. You get 5 hours to take that exam and you get 85 to 150 questions. And remember, out of those 85 questions, 15 of them are research questions that will be used to improve the exam. Just like if you've taken the old NCLEX, they all do the same thing. Okay. Let's see. All right. So yeah, appreciate everybody jumping in and chit chatting. How many likes we got? Oh my God, we got 500 likes. Hey, I appreciate y'all. Hey, smash that button right now. Hey, let's get up to 1,000 likes right now. I know y'all just sitting there lurking, being a couple. Hey, let's drop them right now. Hey, let's get up to 1,000 likes right now. All right. But yeah, like I got a whole cheat sheet here. We're talking about, just things that you need to know, mental health and psychiatry, med surg stuff, IV, blood and blood components, diabetes and insulin, stuff you need to know for oncology, sexually transmitted diseases, pre-op care, acute care, special tests that you need to know, like a pediatric Big thing about pediatrics is benchmarks, immunization benchmarks, like when can you get specific stuff, cardiovascular disorders. So the big ones that you need to know are, of course, you have, what are they? When it comes to cardiovascular disorders, tetralogy of Fallot, congestive heart failure, rheumatic fever is another one. What is it? Pulmonary stenosis, overriding aorta, right ventricular hypertrophy. Like these are some really, really good ones that are, some really quick things to jump into. Chadwick sign, talking about maternity, our thyroid stuff, nutrition. Nutrition's really good to know, especially if you're giving some type of, like an MAO inhibitor, right? Like guacamole, right? Or avocado, right? Thinking about those. And then so many other ones that I got up on here. Dosage calculations, little snippets to kind of help out with that. Conversions, fall risk, stuff like that. And remember, this is to anybody. I don't care who you are. If you decide to get a cheat sheet or not, is to conquer the NCLEX. It begins with you. Period. It begins with you because you are the only person that's going to take this NCLEX. I'm not taking it with you. So, we'll say Coco. I know you in here floating somewhere. She ain't taking it with you. She may be there in spirit, but she ain't sitting there next to you taking the exam. Right, because she takes the exam by herself. Now, remember, like I said, to conquer the NCLEX, it begins with you. Period. All right. We had 1,000 likes. Hey, that's what I'm talking about. I appreciate y'all. So much. Hey, so if you guys are just joining, my name is Kevin. I go by the Boot Nurse. That is my alias or my name. I am a nurse and NCLEX coach. I specifically work in the operating room, and I enjoy it. We're talking about the new generation NCLEX. We actually just went over a bunch of the updates for the NCLEX itself. I see that somebody jumped into the free coaching that I got on here, so I appreciate it. When that time comes, we will make some stuff happen. So, yeah, if anybody in here needs coaching, you guys know where to find me at thebootnurse.com. I would love to, for the 30 minutes, try to point you in the right direction of the things that you need to know for yourself, as well as mentorship. Like I'm huge on mentorship. I'm huge on motivation because when I failed my NCLEX, I had a good mentor, and I didn't even look to find this individual. He kind of just fell into my lap. And those are the ones to me that felt the most genuine, are the people that just were there, that helped out, if it's not to motivate, point me in the right direction, tell me about different type of study materials, so on and so forth. I personally used Mark Klimick and I used Kaplan to help me with NCLEX. I have used UWorld, didn't like it because it didn't give me the content that I needed for myself. I didn't even know about Archer until after the fact. Picmonic is another one that I didn't hear about until after I graduated nursing school, but I had access to their stuff and I like their stuff. It's not bad. Simple Nursing, didn't even know that dude had a review until after the fact. I used his NCLEX, not his NCLEX, but I used his YouTube channel, especially for pharmacology. So the motivation that I have are from all of those people, like Mark Klimick, Regina with Remar. I like, there's another dude on there. His name is Alpha Slice. I like him and I like some of his stuff. Who else is on there? You got Archer, you got UWorld. There's another one. I think it's, is it Princeton? Of course, the NCSBN, they have practice exams as well. Who will? Hearst, the Hearst review. Now, here's the thing about Hearst. I don't mind Hearst, but I couldn't use Hearst because Marlene Hearst has a very thick Mississippi accent. And, she's country, y'all. Granted, she could be the smartest person in the room, but I just could not stay focused listening to her. So, so what reviews are y'all using? Like, what reviews are you guys using for NCLEX? Or what reviews have you used that you would recommend for anybody else to use? But also remember, at the end of the day, it is what you decide that you're going to use for yourself. And if it works, You'll never know until you try it. And I also want people to think about in using the word investing instead of saying buying, because when you invest in an NCLEX review, it is not just buying it, and it's not like buying, a PlayStation game or an Xbox game or a PC game and just playing it. It's not like buying, Game of Thrones and watching the whole season. Like, you literally really, really have to invest in what you're doing. You have to invest in what you're doing as well as invest in your future. Don't look at spending, $200, $300, $400 as a waste of money. Right? You have to think about it as like, I'm going to buy this program and I'm going to know the insides and out of this program in order for me to get this license, because I don't want to have to take this exam more than once. And I'm going to be completely honest with you. After all the money I spent on reviews and all the money I had to spend retesting, sheesh, let me tell you, it cost me some money, right? But it was I would say it was an expensive learning experience. And I'm going to tell you why. It wasn't even about the money. It was about the time. It took me 2 years, almost 2 years to get my license, because I graduated in August of 18 and I got my license in June of 2020. So it took me almost 2 years to get my license. So the money I don't care about. I can replenish that. It's the most replenishable thing on earth. And especially the way that people look at money and currency nowadays, if you've been paying attention to the news, money, you can replace that. I was like, but my time, I could not get back. I could not get back that time. And the stress that I had for 2 years that I put on myself and all the other multitude of things that were happening in my life, it didn't help. So don't look at buying any type of review as, I'm just buying this review, right? Think of something and change your mindset about, okay, what review can I invest in that I can dive as deep as I possibly can to understand what is happening and what I'm looking at, so I can take these questions and, get the highest score that I can, understand this content, take down the notes so I'm able to retain it, and then remediate after I take my exam so I can continue to retain the information that I've learned. That is what investing is all about. It's just like investing in real estate. I'm not just going to give you money so you can go out here and just be like, yeah, I'm just going to buy this house. It looks good. Yeah, but it's in the middle of the ghetto where they got freaking, gun monitors going off. You're going to be like, oh, well, I don't know why we can't rent this place out. Make it make sense. All right. So don't think of just buying. Think of something that you can invest in. Okay. Which is why I'm coming out with a mini course. So my mini course is called Back to the Basics. It will be out soon, so I want you guys to be looking out for that. I'll be dropping links. So back to the basics. We're going to be talking about how to create a study plan for yourself, how to put yourself on a schedule, your time management. We're going to go over delegation on NCLEX, legal stuff, interdisciplinary stuff. Like we're about to pull out all the stops. Okay. And so, like I said, the invest, you want to find something that you can invest in. Okay. Because investing is part of your way it begins with you, right? You got to educate yourself. I'm trying to use free resources for now. Okay. If you want to use free resources, that's fine. But here's another thing I want you to realize is that free doesn't mean it's always good. That's number one. And two is that if you use so many free resources, let's say you have, if I have a whole list of free resources right now, from YouTube channels to websites, to Facebook groups, you name it. But how do you cancel out all that noise? Because they're all going to be relatively saying the same thing, but then they're going to have other nuances that are not going to make sense to you. You're going to be like, but they didn't say this, but they didn't say this. They didn't say this. They didn't like there's too many hands in the pot. Too many chiefs, not enough Indians, if that makes sense. So free is not bad. But free doesn't guide you. Free is just there. It's kind of just floating out in the ethers. A lot of times you can get a review and it'll guide you. Like, hey, look at this from the beginning. Or, hey, take this test. Let's see where you are. All right, cool. Maybe you should start here first. All right. But free resources aren't bad. I recommend free resources to everybody because, I'm not in your pocket like that. But I do recommend free resources to anybody before they decide to make a decision for themselves. Okay. I've used Simple Nursing and Ninja Nerd. Those are good ones. I love Simple Nursing's YouTube. I never use his program, but I use his YouTube channel, especially for pharmacology, like the cardiac meds. Loved them. Loved them, loved them, loved them. They were great. Ninja Nerd, I've looked at that YouTube channel a few times. And it's also one of the free resources that I always recommend to people. So I like them both for sure. Have you taken the NCLEX? How was your experience with Simple Nursing? Oh, that was a question not for me. I have not taken the NCLEX yet. Okay, so Hancock. When are you taking the NCLEX? Now I'm curious. Now I'm prying and I'm asking you questions. What you think? I'm assuming you say, what do you think about Archer for retake? I don't know. What'd you use the first time? Here's another thing about these reviews as well. A lot of these reviews are really, really good. Now, it's all about how you use them. There's people that tell me that they use UWorld. They swear by it. Kaplan, they swear by it. Hearst, they swear by it. Archer, they swear by it. Picmonic, Princeton, Remar. They say they swear by them, right? But it's all about if that review is right for you, right? That's just like being in a relationship. You know, like you get with them and it's all lusty and cool and it looks all nice and pretty on the outside. But then like once you're like inside the program, you're just like, bro, this is not it for me. And it may not be it for you. But the thing about it is like sometimes you have to trial it out in order to see. I'm just keeping it a stack. No cap. That sounded so old. Like, I'm sorry. Anyways. So, but yeah, think about it like that. Taking the NCLEX, what do you think about Archer? To answer your question about Archer, I like Archer's review. I've used Archer's review many times when I've helped people when I've coached people. I like their stuff. I don't mind their questions at all. Yeah, I think they're okay. I used Archer, UWorld, Simple Nursing, NCLEX Crusade, and Mark Klimek review on YouTube, and Mark Klimek. So let me tell you something about Mark Klimek. His review, number one, he does have a review, like a Klimek review. He does have it online, and I can't remember. Correct me if I'm wrong, Coco. But they should still be doing to where like they actually have live reviews that you can go to. I actually went to a live review in 2019, and I got the yellow book right here. And I was gonna give it to somebody, and I'm glad I didn't because now that's a piece of history. Because you know that man, Mark Klimek, is old. You know what I'm saying? And I base my whole motivation off of him, because I listened to those audios like they were going out of style. Right. But his review is fantastic. Like it's exactly like the audio, but it's just more up to date. So if you have the old audios, they are probably about 90 to 95% accurate, with a couple of nuances that have changed in between there. Who is this? Is it bedtime? It's bedtime. All right, cool. Well, I mean, it is 9:30 in Texas. So, I mean, it's about time for me to go to bed. Well, I failed with Archer and UWorld, but it's me. I'm the problem. Hey, the first sign of, getting through that hump is just admitting that you're the problem. So, and I kid you not, like I used UWorld on 3 different occasions, and it didn't work for me. And maybe those type may not be good for you. Maybe is there something in there that you're not able to retain. So I had a friend who used UWorld and used Archer, and then she went to go use Hearst for the content, and then use Archer, use the UWorld for the questions. And she passed. Her name is Manasa, and you can go over to my freaking YouTube, you can go on my Instagram, and you can go on my TikTok, and you can see the one where it says, I passed NCLEX on my 7th attempt, and that was her. I'm just saying. Unfortunately, I'm still taking my RN classes. I'm hoping to be done next spring with the classes. Hey, remember this one thing at a time. So you ever heard, all right, so everybody know what the word focus is, right? Focus on, oh my God. Or is it focus on one course at a time or something like that? I forgot. Focus, something like that. Now it sounds stupid. I got to find it out. But focus just means focus on one thing at a time. Now it sounds stupid. But yeah, Hancock, focus on one thing at a time. Your NCLEX time will come. And trust me, in my opinion, you'll have plenty of time to prepare because you know it's coming at some point. I watch your reviews on YouTube and downloaded the lecture notes. That's great. Because I'm telling you, like, if you can remember those things, like, who can sterilize my bowel? Who can tell me that? I'm going to do the NCLEX remedial because I was scared to fail again. Okay, don't be scared to fail. Failing is a part of life. But what is not good is for you to fail and then feel sorry about yourself and then never keep going. I love it when I hear people say, it's my dream to be a nurse, but I failed the NCLEX. And I was just like, okay, so you mean to tell me your dream was just a wish because you don't have any goals or any type of strategy to try to get over that hump of making your dream a reality? Stop playing with me. So don't be scared of the NCLEX. It is just a test. If it is the one thing that happens to you today, the one thing that happens to you today is failing your NCLEX, I think that's okay. Because hindsight's 2020. Let's talk about perspective. You could be in a different country right now. Heaven forbid, and this is no joke, you could have been at Louisville, that bank or that campus that got shot up today. Like the world is wild today. You could be in Ukraine. I have 2 friends that are from Ukraine and that they live here and they have family that live in Ukraine. Imagine being in a war-stricken country. America will never feel something like that. So like I say, hindsight's 2020 and perspective. If you failing the NCLEX is the worst thing to happen to you today, I think that's okay because now I can audit myself based off of that list and I can go back and take that test again. I can't stress enough watching videos on how to critically think through NCLEX. That's 100% correct. You have to be able to understand NCLEX style questions. You have to be able to have the content in order to understand them. Some people will just be like, hey, you really don't need the content. Let me show you a trick on, the things that they answer in the question. What the fuck? Like, make that make sense. If I start asking you a question about diabetes and we start talking about glargine and Lispro, okay, when do I need to get, what is insulin going to do? Drop my glucose or bring it up? What is it going to do? Okay, when should I feed them? How long is that's stupid. Like, you have to have some basis of content in order for you to answer NCLEX style questions. But that is important because on the exam, it doesn't ask you content, it asks you questions. So I agree, Coco, for sure. The remedial lady told me I need to read the Saunders book. She saved me $1,000. The remedial lady, is that an actual person? I need to find that person now. Neocan, that's what's... I'm glad you answered that. I appreciate you. So the remedial lady said, read the Saunders book. Okay, so let me ask you this question. And this is a question that I ask in my coaching bedtime. What type of learner are you? Are you an auditory? Are you kinesthetic? Are you a auditory kinesthetic? Are you a visual? Are you a read write? Which one are you? See, now I'm curious now because I could tell anybody to go read a book, but if you put a book in front of my face, I'm falling asleep. You're all of them. Okay, so you're all of them. Which one are you geared most towards? So Karen just said that she's auditory. So Karen, if I was to put a podcast on and we started talking about, I don't know, I'm really big on entrepreneurship right now. So I'm listening to this one called Entrepreneurship on Fire. It's a really good one, kind of bland, but the story's pretty good, right? Anyways, so auditory, I listen to that. I could hear it. That's why I love audiobooks. I've listened to Rich Dad, Poor Dad and this book right here. I'm going to show you. No! You guys are looking at the floor. Hold on. There we go. All right. There we go. So I listened to Rich Dad, Poor Dad so many times, and I read this book on audio. It's called The Nurses, right? And it's called The Nurses, A Year of Secrets, Drama, and Miracles with the Heroes of the Hospital. One of my mentors gave me this for graduation. She wrote a little something in there. So I hold this very near and dear to my heart. Every nurse in this chat needs to get this book right now. But the reason why I say audio is because I listened to that book and I could retain everything, damn near almost everything that was said in it, right? So maybe that's just another type of study technique that needs to be incorporated in how you study. And so you're telling me all of them, right? But I can guarantee you there is one that sticks out more than the other. Or maybe you just don't know which one to hone in on. And that's not a bad thing. And visual, Coco. So I'm assuming with Coco, things that are visual, she has to see it. She can see it in a video and she can understand it, right? So if I started telling you the way the flow, Coco, if I started telling you how the flow, how the flow of the heart goes through the right atrium, with the SA nodes going down the bundle of his and the Purkinje fibers and all that stuff. If I showed you all that, you'd be like, damn, that makes sense to me, right? Visual and hands-on for me. Okay, so visual, same thing that would go for you, Hancock, right? Hands-on, you can't really do that on NCLEX, right? You can't be touching all over your computer because then they're going to put your shit on hold, and we don't want that, all right? My school offered us a 2 free month after graduation for Kaplan, and I passed on my first time. So I'm going to tell you, I love Kaplan, but this is my hard-headed self saying I didn't want to spend any money. I didn't want to invest in something. I didn't have the time to do it, yada, yada, yada. Stop playing with me. Stop playing with me, yo. You're talking to a person who failed 3 times. You talking to a person who failed 3 times. So people to come up to me to be like, oh, I can't do this and blah, 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 blah. I don't want to hear it. I don't coddle people because I'm going to tell you, I'm going to audit you. I'm going to tell you about it because if I don't tell you about yourself, how in the world are you going to succeed? You won't. You won't. I'm visual. I picture things in my head. Exactly. Bree, same thing. Also hands-on. You need to see it. That's what I'm saying. Like, I can't just be like, hey, what does ventricular fibrillation sound like? I don't know. But if I saw a picture of it, I would know. Right? Okay. So here's your picture for my visual people. If I put it on an EKG and then you see, if you don't see a if you don't see a P wave or a QRS complex, and it's all over the place, I'm pretty sure you can visually see like, no P wave. Okay. No QRS complex. What the hell's happening with that EKG? Is my patient breathing? No. Do they have a pulse? No. So what are we going to do? CPR? Damn right you about to do CPR, right? So it's stuff like that. Just downloaded the nurse's book. I don't know what that is. What is the nurse's book? Hey, enlighten me, please. And somebody said something about the remedial girl or remedial lady. I don't know exactly who that person is. So please enlighten me on who that individual is. Like, let us know. Let us know who these folks are because I don't know who those folks are. Because I might want to look them up and be like, hey, somebody mentioned you and I wanted to give you a shout out or whatever. You know what I mean? So, anyways, if you guys are just joining while you guys are dropping all those comments down at the bottom, hey, we got 1.3K likes and I appreciate y'all. But if you guys are just joining, my name is Kevin. I am an NCLEX coach and I'm a nurse. I've been a nurse for almost 3 years. Funny story, I've been an educator since 2015, so 8 years now. I am what the military calls a master instructor. I have taught in a plethora of other things, such as I was a surgical technology instructor for about 3.5 years, on top of a couple of other instructors for some other courses, a combat casualty course, advanced burn, pre-hospital trauma life support. And currently, I am a trauma nursing core instructor as well. And so, teaching is what I love. I'm actually going to go back to school to get my master's in education, just so I could, so I can be more informed on how I, talk to you guys and how I, provide information to everybody. Anybody interested in a shirt right here? Check out the Boot Nurse. You guys can go to thebootnurse.com, hit store, and it'll take you over there to that store. You guys can see all that stuff. It's just a remedial class on the NCSBN webpage. Oh, okay. I reached out to a couple of them after failing. Okay. You just had it in your hand. What did I have in my hand? Talking to me? Hancock? What I have? What I forgot in my hand? I don't even know. I forgot. But okay. So that's what the remedial. Oh, so those remedial classes. Okay. That makes sense. I actually forgot that they had those. So it says, but the remedial classes are expensive. So the lady that I spoke with told me I need to read Saunders. Okay, cool. Okay. Oh, the nurse book. You want to see what the nurse book? Oh, okay. So it's this book. I'm sorry. My bad. I'm slow. It's been a long day. So it's this book. It's called The Nurses. A Year of Secrets, Drama, and Miracles with the Heroes of the Hospital. This book, y'all, I kid you not, it's like Grey's Anatomy. It's wild. It's wild out here, bro. It's wild. Like, one nurse in here got addicted to drugs, and like her story is wild. Another nurse was talking about how this neurosurgeon was sleeping with like all the nurses like on different floors and got one of them pregnant. And I'm like, yo, it's wild. It's wild. And so I'm assuming you're saying, just to make sure I'm understanding, because a bunch of people are jumping in here, and this is for bedtime. You're talking about the remedial courses are expensive. Yeah, they are. They are. Those remedial courses are expensive. And to get the Saunders book. The Saunders book is cheaper. I think it's like, what, maybe 20, 30, 40. No, it's like less than $100. See, let me not even try to guess. But if you're a person that can read and that can retain that information, by all means. I just know that if you put a book in front of me and tell me to start studying, I'm gonna fall asleep. The fastest way any of y'all want to fall asleep, read a medical book. Read the med-surg book. Read that big ass book, and you'll be asleep in 10 minutes. Unless you're just some kind of psycho, and that's the kind of reading that you want to do for yourself. So there's that. For all the people that just jumped up in here, or you have been in here for a while and you haven't said anything to me, first of all, rude. Second of all, let us know where you're from. Let us know where you guys are at in your nursing journey. Are you a brand new nurse? Ooh, I know that name. James. I know that name. I think. If that's the same person that I'm thinking about. You need water? Well, I mean, I got an empty Gatorade bottle. I don't know what you want me to do. I don't know what you want me to do about that. But yeah. So yeah, we just hey, like right now we're just hanging out. I'm working on a couple of other things right now. In regards, like I said, creating a mini course for you guys. That also is going to be over on the website, and when that goes live, we're gonna make some stuff happen. I'm also creating, like, I have this freebie right here. Like, it's a 17-page cheat sheet. Honestly, the first 2 pages of that are just me telling you important stuff that you need to know. And then the rest of the stuff is all of the quick little things that you need to know. And that'll also be on the website. And then I'm also going to be doing webinars. Like, we're actually going to do actual classes. They're going to be anywhere from, like, we'll say 30 minutes to an hour. Go through the lecture, start answering questions, and these are going to be free. So who is that? Bedtime? Like, if there's a topic, like that you feel like you need help on, and I'm going to start doing polls and stuff like that. Like, hey, what topics do you guys want to talk about? And then, we could do a class on it, and I'll send out the link. Y'all sign up and we'll get it moving. We'll get it moving. Sorry, I didn't mean to send that here. Wow. Okay. Thanks, Bree. How you know I don't want no water? It's rude. No, I'm just playing. You good. 5 year, is that Zara? Did I say that right? Zara, 5 years and a nurse. Or 5 years, AD nurse. I'm guessing, does that mean like a associate's degree nurse? First of all, I don't care if you got a 2-year nursing degree. What that got to do with anything? Do I look like a hospital that I care? I'm just playing with you. You good, though. 5 years. What do you do, Zara? What type of nurse are you? Bedtime. Sorry, off topic, but what's your thought on Capella for BSN? Capella, I'm guessing you mean Capella, the school. The school, Bedtime? Or Badine? Is it Badine or Bedtime? You gotta let me know. I'm slow. It's almost 10 o'clock here, so I'm slow. I'm slow. Gotta let me know. Sorry if y'all hear my son. He's just, he cries a lot. He's such a crybaby. He's one, though. So you already know you're gonna cry. Yes, the school. I haven't really heard anything bad about him. No one's really brought them to my attention in regards to going to school. However, there is another school. Has anybody gone to Western Governors University? WGU. I know that they're not in every state, but I know that they do have like certain states that they don't go to, or certain states that you aren't. That I guess that they don't really frequent. They have an RN to BSN. So if you already have your 2-year RN degree, you can go to their BSN program, and you can do it all online. If you have a 2-year RN and you want to go for their master's program, they could do that. You could do that as well, all online. They do have a BSN program as well. It's online, but there are a little bit more restrictions on it. Like there's, you have to get the basics of being an RN. But they have their own type of schedules. But once you have your RN, if you want to do RN to BSN or RN to MSN or FMP or whatever that they have, go check out their website. I can tell you right now, I think it's actually pretty damn good of like what they offer. So I'll probably be going there for my master's, just for the simple fact that, it's convenient. Like once you start school, they open up all the classes, at least for the master's program. They open up all the classes for you. And then you have up to 24 months to finish the entire school or finish your entire program. So if you're motivated enough, you could really get your master's degree in 6 months. I know one of the nurses that I work with, she got her master's degree, and now she's a family nurse practitioner. She has been for a couple of years, and she finished her master's program in 10 months. Like, that shit is wild to me. Wild. You hear me? Wild. So WGU, you can check them out as well. Wait, what school is this? Bree, hey, pay attention, ma'am. Pay attention. We're talking about, it's Western Governors University. I'm just playing. Western Governor, WGU. 12 years LPN. Hey, shout out to you. Hey, my cousin is an LPN, and she works up in New York. Not in White Plains, New York, or White Plains, Canada. I don't even know where White Plains is at, but it just sounds like it's somewhere in Canada. I don't know. I'm sorry. But, hey, but shout out to you. Let me tell you something. When I worked in the ICU, I didn't have an LPN at all. None whatsoever. When I worked in the medical and neuro ICU, when I worked in the burn ICU, we had LPNs that worked up there, or LVNs, and they were awesome. And they taught me a lot about wound care when I was a boot. I mean, I'm still a boot, but as a brand new nurse, as a boot nurse, like, they were teaching me wound care, and I loved everything about it. I was learning so much from them, and I appreciate them. That was my first experience as a nurse, as well as, working in a burn center. And I wish I could have worked there like longer, but they were just like, nah. I'm like, all right, cool. So let me go back up. Where was it at right here? What school is this? Yep, 12 years LPN. Yep. I need help with passing AMP 1 and 2. What's MT? What is that? MT. Pharmacology, even micro is tough. NCLEX doc. Who is that? How you say your name? Is it Lin May? Lin May 58. Oh, so you just need help with everything. You just want us to do everything for you, Lin May 58. Lee. Honestly, I loved micro. Oh, medical terminology. Oh, okay, Lin May. So you must be So you're on your journey for nursing. You obviously are not in nursing school, correct? I'm assuming this question is just strictly for you. And I loved micro. Like, micro was probably one of my favorite classes. That one and pathophysiology. Not really. I write to stick in. Oh, okay. So you want to know, here, let's see. I need help on passing AMP 1 and 2. So, hi there. When can you tutor in the day for 30 minutes? Well, who is that, CC? Well, I have a job, so I usually don't get home until about 4 or 5 in the afternoon. And then I have some other, fatherly duties that I have to take care of. So usually it's not until 7 or 8 o'clock to where I can do that. So, unless it's on the weekend, but then there have to be special considerations for some things to work. So, I would just say sign up, and then we can see what we can possibly do. While they are still available. I had somebody schedule all the way out to June, and I'm like, do you not want to talk like on Saturday? I don't know. So, it says, yes, I am. I got a 94 last module. Pat my back on. Hey, that's okay. So here's the biggest thing about when you're doing your prereqs. A's are great. B's are good. We don't want C's. Although, you can get into nursing school with C's. However, we don't even want to give a nursing school any of those looks, as in like, oh, they got a C, ew, get them out of here, right? So you just got to learn you just got to play the game. Do you work at a doctor's office? If so, how's that? I don't work at a doctor's office. I work in a hospital. And I specifically work in general and OBGYN, and I work with the robots. So, I don't work in a doctor's office. I just work at the hospital in the operating room. But there's a lot of good websites that are out there, Lin May, for AMP 1 or 2, not Kaplan. Oh my God. I was talking about Kaplan so much. Khan Academy is a really good one. Like Khan Academy, I would say single-handedly, in my opinion, was fantastic for everything for AMP. I remember we were going through the heart lab, and we were talking about the different portions of the heart and how the blood flowed and stuff like that. And I, for the life of me, didn't know. I think like somebody in my family had passed away, and I had missed the lab, and he told me I can come in for a different day, and I didn't study. No lie, during the first portion of that class, I watched a video on Khan Academy on their YouTube channel, and took the quiz. Not the quiz, but we did the lab right after that, and I got a 99. I was just like, ooh. So for A&P 1 and 2, I would most definitely say Khan Academy. Pharmacology, there's so many other ones, like, what is it, Farm D. Here, I'll find it. Look, I got some other stuff. I got some other YouTube channels for y'all. Look. If y'all find value, make sure y'all smash that out. Hey, we're at 1.3. Hey, 2K. And I ain't talking about the basketball game. 2K. I want 2K right now. Smash the whatever's happened on this side. I want to see nothing but hearts. While I look for these YouTube channels and free stuff for y'all. Playing games with me, and y'all don't want to even give me no love. That is mean. Oh my God. Oh, so ain't nobody gonna do it? Rude. Okay. All right, so let's see what we got going on over here. Let's see. Nope, that ain't it. Okay, here we go. Helpful YouTube channels. All right, let's see what we got. So of course, mine. Everybody needs to go subscribe to my YouTube channel right now. It's the Boot Nurse, and you're gonna see my glorious face in my uniform. So yeah, just go and subscribe to my channel, and yeah. Next would be I said Khan Academy. So if you really want to look at Khan Academy, I would definitely say look at their YouTube channel, because they're really great for pretty much anything, any type of prerequisite courses. They're great. I'm 42 now, and I do buy books. I write to remember. I just happened to see this, and thank you. You're welcome. Oh, so you want book recommendations? I don't even have, like, all of my books are, like, literally in the garage. And so websites are the best ones that I like to recommend to people. Hell, I even got a good app, like, for pharmacology. I loved Hippocrates. Or I think that's the one I use, is Hippocrates. It's actually a pretty good one. And you're 42? I don't know, what's that mean? What's that mean? Just because you're 42 don't mean you can't come out here and get this license and get this work. Come on now. Stop playing games with me. You good? Good out here. So Khan Academy, of course, we talked about Simple Nursing. Registered Nurse RN, hers is really, her stuff is really good. Yes, I have Khan on YouTube, even Google too. Thank you. I am old now. I'm working on it. Old? First of all, ma'am. You're not old. You're just mature. God, I hope you're mature. My sister is 42 and she is not mature, let me tell you. Nah, you're good. We all good out here, right? You don't even think that you're old. It's all about how you feel. So don't tell me in here that you feel old, because you're not old. All right. Khan Academy, Ninja Nerd. Oh, here's a really good one. Osmosis. If you go to YouTube, go to it's Osmosis. OSMOSIS, and specifically look for Osmosis Nursing. I like their YouTube channel. They talk about all kinds of stuff. There's another one called MedCram, MED Cram. MEDCRAM. Really good one. It's ran by a doctor. He goes over pharmacology all the time. Like, I looked at his video when I was learning about pressors. Pressors medications, like your Levophed, vasopressin, and all your other pressors that you need for hemodynamics. No, you did not say Quizlet. Hey, you better stop. I don't like Quizlet because there's too many things that are out there, and I just don't believe Quizlet. That's just me. I feel like if you're going through prereqs, Quizlet is great, but nursing school, Quizlet ain't it, because it's just, oh man, it just feels like it ain't it. So, Cram, MedCram. Oh, Tony Farm D. That's another one. Tony, TONY. And then Farm D. Just the letter D. So PHARM and then the letter D. Nursing SOS. That's another one. What else is on here? What else I got? For if you want to know, for anatomy and physiology, it's called Crash Course. So type in the YouTube channel search Crash Course Anatomy and Physiology. That's a good one. What is it? The Amoeba Sisters. That's a good one. 0 to finals. I think that would be really great for you too, Lin May. And then Nexus Nursing is another good one. Yes, I know those, and you too. Thanks. Oh, okay, cool. Those are all the ones that I like to recommend to folks. So if I told you ones that you know, then sorry. I try my best. Let's see. We talked about Level Up Nursing, which I'm pretty sure most people know a lot about her and those pharmacology cards. Nursing.com, Simple Nursing, Picmonic, Ninja Nerds, which we talked about earlier. Nursing Camp. So Nursing Camp, just the word nursing and then camp. It's spelled with a K. And then Med Simplified. What about those? Do you know those two as well? And yeah, I think those are it. I think that's the last bit that I have right there. So yeah, most definitely, Lin May, you got this. You got this. One thing at a time. One question at a time. One subject at a time. Let me tell you something right now. Don't be in a rush. Don't be in a rush to get out here. Don't be in a rush to rush through those, really absorb everything that you're learning. Because once you get out here, it's like pedal to the metal and you start moving. As well as, I'm one of those people that I'm a very big proponent. It's just like, you were right where you were supposed to be. Some people are just like, well, I want to do this and I wish I would have been there. And I was just like, nah, you got to go through that journey. You were right where you were supposed to be. If you close your eyes and you woke up as a nurse, you'd be like, how in the hell did I get here? You know what I mean? So just always say to yourself that it may not be where you want to be, but you were right where you were supposed to be. Because it's a journey, it's growth. All of that goes hand in hand with, not just becoming a nurse, but, just you as a person, like you as a whole. Okay. So, but yeah, I think I'm going to call it quits for the night. If anybody else has any other questions about anything, you guys can drop them down here, down in the comments. So let me know what's up. We can chit chat about it. Like I said, if you guys just joined, my name is Kevin. I'm a nurse. I'm an NCLEX coach. We just went over NGN stuff and, dropping some stuff up in here for, hopefully everything that everybody can, is useful, as well as I do coaching. Check out thebootnurse.com for merch, as well as if you need or want or seek out help for coaching on the NCLEX specifically. I get a lot of people asking me, do I coach nursing students? And I was just like, I can coach you. But I specifically want to coach nursing students that are at the tail end of nursing school, so I can get them to focus on NCLEX, because NCLEX is, like where it really fits. However, I have coached nursing students before in the past, specifically nursing students that came up to me that recognized me at my job, and they were just like, "Can you coach me?" And I'm just like, if you ever come to the OR, I'll precept you, and then I'll give you all the knowledge I can within like the day that you're with me. And a lot of them love it and a lot of them appreciate it. So that's probably as far as I go with nursing students for now. Yes, I serve the net YouTube. I have all those subjects right now, so I can finish this. Thank you so much. You're very welcome. Yes, ma'am. How can I study NCLEX PN free? I have used and bought all resources and I'm burnt out. How can I study NCLEX PN free? Pretty much, honestly, you just got to scour the internet and look on YouTube and use whatever free stuff that they have. That YouTube is free. You say you bought all resources. And so now this is another thing that I ask people in my coaching. Okay, what did you not do? And yeah, that's what I'm going to say. I don't care. And I'm telling you right now, it doesn't. Sometimes it takes somebody else to let you know what you're not doing. So I bet you, CC, if you and I were to sit down and have a conversation, I bet you within probably the first 15 minutes that I would be able to find out what is really impeding you from succeeding. So you're telling me that you bought all resources. First of all, there are a lot of resources. Secondly, it's just like, how did you apply them? Thirdly, it's just like, we could talk about support system. Do people support you? Did you have any family issues going on, work issues, children, grandchildren, adopted children, like dog, like, I mean, it could be anything that could be a possible distraction. Do you not understand content? I mean, truly, do you not understand content? And we're talking about PN. Do you not understand your role? Right? Do you not understand the RN's role? And a lot of times for LPNs, they have a hard time letting go of their role, knowing they're just like, okay, on the NCLEX, it says that only RNs can do IV medications. But then you hear an LPN say, well, I'm IV certified. Whoa, pause, hold up. No one said that. NCLEX don't care that you're IV certified. No one cares. Not saying that I don't care that you're IV certified, because that's a huge thing to do and to have as an LPN. But that ain't it. That's not what they're looking for. So, yes, I bought a lot of them. I paid big bucks, etc. Yes, we need to. Ma'am, you know where to find me. You know where to find me. My days are very sporadic. Sometimes I can be home during the day, and sometimes I won't be. Put it this way: if you schedule yourself for if you schedule yourself for a 30-minute consultation, just follow it. Fill out the biggest thing is filling out that intake form, and then I'll see it. It'll pop up here on my phone. And then if I see who it is, see your name, what I can do is, if I have free time throughout the day, where I'm at home or I got some time to kill, I'll move it and I'll message you and I'll be like, hey, are you free? Or when are you free today? And we can make something happen. But that comes very few and far between. But it is not out of the ordinary for me to talk to somebody like that. So, but yes, that can be one of those things that are available to you. So, I would definitely check that out. Also, make sure you guys are following me on Instagram. Hugely follow me on Instagram, because I'm going to start dropping links for where you guys can get freebies like this cheat sheet, and as well as I'm going to be dropping links from when I'm doing webinars, because I'm going to do free classes. Like one of my very big classes, very first big classes that I want to do is delegation on NCLEX, and that's coming here in the next couple of weeks, as well as my mini course that's coming. You know, it's back to the basics, right? And I call it back to the basics is because we forget, like it's the basics of the basics on how to prepare yourself for NCLEX, how to understand NCLEX style questions, content, how to schedule yourself, how to audit your time, and just like a whole, like I'm gonna read it off my list right now. I'm gonna read it off my list so y'all know I ain't playing no games. So like we're gonna talk about time management, study tips and creative ways to study. We're going to talk about lab values, the things that are super important that you need to know, legal issues, interdisciplinary teams, like who's a part of the team to help you, restraints, delegation on NCLEX, designing a study plan, creating a study schedule. Hell, I even have one in there for repeat test takers. You know what I mean? So, and then, it's like the road, this is the roadmap, back to the basics. These are the things at the bare minimum that you need to know in order for you to get to where you want to be. And this is just the beginning. This is just the beginning, okay? The mini course is just the beginning. Trust me when I tell you it is just the beginning. I got a bunch of stuff planned for y'all. I just want y'all to stay tuned, and I want y'all to be patient, okay? So, if no one else has anything else to say or ask me, but Lynn May just dropped something. I have studied or watched Mark Klimic 1 through 12, excited to get NCLEX, but I have to finish my pre-nursing. Ma'am, when I tell you that first of all, I want you to keep listening to that. But you are very far away, but you are so prepared for that journey. Like it's wonderful, because I wish I would have applied and listened or even had Mark Klimic back all the way back in 2012, 2011 timeframe. I wish I would have had that, because maybe I would have had a better outcome going through my whole 5, 6, 7 years of trying to become a nurse, because it took me a very long time to become a nurse. So, yes, I love that. You definitely keep doing that. I know still a ways to get there. Yep. But before you know it, you close your eyes and boom, you're going to be there. Right. So, keep doing that. I love the fact that you're doing that for yourself. But anyways, I appreciate everybody jumping on. And we're chit-chatting and going through everything. If anybody, of course, has any questions about anything, go over there and follow me at The Boot Nurse on Instagram, TikTok, Facebook, YouTube, all those places. I'm super active on Instagram. I'm very active on Instagram. Also, if anybody that you know misses this video, I'm going to start putting my TikTok lives up on YouTube so people can watch them. So, yeah. So that way it can be super helpful for everybody. Because I know a lot of people are just like, man, can I rewatch this? Well, if you get subscribed to my YouTube, it'll be there. It'll be there for you in case you miss it. So, but anyways, I'm going to go ahead and I'm going to get up off here. Oh, man, somebody asked me a question. How do you think AI will incorporate into nursing into the future? I can't say never, but AI will be very, very good for informatics, I believe. And when it comes to, it'll be very good for informatics, like when it comes to improving the technology in regards to the things that we use every day in nursing. But getting rid of an actual human interaction is going to be very few and far between. But AI is a very finicky thing that is happening right now. I actually welcome it in certain areas because it really, really, really can actually help, limit errors. Like, for sure. It definitely can limit errors. Next live, let's talk about RN jobs that aren't 12-hour shifts. Yes, ma'am. Hey, you know what? We will talk about that. We will talk about those jobs. We will talk about those jobs that aren't 12 hours. Hey, nursing has changed to the point to where you don't have to go work bedside. You don't have to go work bedside at all. I know nurses that graduated nursing school and have never touched a patient. And now they work like some insurance company or they work, doing something else. Trust and believe. I got a whole list of those too, and we could talk about that for sure. So, but back to your question, Penny. This is going to be the last question. So don't be trying to drop no questions in here on me. I think time will tell how AI will be integrated into nursing and into the medical field. But the human aspect of medicine and nursing, not so much. Not going to go away. At least not for a long time. So, but anyways, like I said, I appreciate everybody jumping on to the live. Next time we do this live will be on Friday. I have drill this weekend, so I got to go do my military stuff this weekend, but it'll be on Friday. But make sure you guys have that notification bell or notification on because I might jump on Wednesday. I don't know. But I can tell you right now, at the earliest or the latest, I should say, it will be Friday at 7 o'clock Central Standard Time, Texas time, whatever you want to call it. So I hope everybody has a great and wonderful evening. Of course, like I said, go follow me over there on Instagram. And I will see you guys on the next live. Peace. Go buy a shirt. Stop playing games with me. Go get one that looks good on you.